suspended for the time being. That's also wonderful to get patients to their medical appointments. The rest of these are mostly COVID-19 related. They are going to help to cover ancillary expenses. And the rules kind of vary on them, but typically it's for those who've been affected by COVID-19 or who are immunocompromised or high risk for COVID-19. So that is going to help out a lot of our population. The first few, Cancer Care Health Well and the PAN Foundation, are available for all cancer. The next ones are just disease specific. So lung cancer, Komen, Colorado for breast cancer, and then colorectal and the blood cancers. So just wanted to throw a few out there. We do have other resources as well. And I'm sorry, I just didn't have enough room on the slide to put all the contact information, but you should be able to easily find these. And if not, feel free to reach out to me and I'm happy to connect you.
So today we have Triage Cancer presenting. If you all have any questions, feel free to put them in the chat, or once the presentation is over, you can come off mute and ask your questions directly to Madison. So we have Madison McMahon Ward. She's the program coordinator for Triage Cancer. She provides administration, communications, and programmatic support. She's worked with nonprofits for over 5 years. Madison has hosted health education sessions on empowering people to achieve their health-related goals. She's got a background in communications, event planning, and customer service. Madison has a master's in public health and a BS in environmental science from Loyola University. She has a passion for working towards social justice to eliminate health disparities and the opportunity to help others. We believe strongly in Triage Cancer's mission to address cancer-related health disparities through the delivery of cancer-related education and collaboration efforts. So with that, I will let you share your screen, Madison, and start your presentation. Thanks for being with us today.
Awesome. Thank you so much, Jen, for that introduction. And thank you, everyone, for having me today. I'm very excited to spend some time with you. So welcome to the presentation on how Triage Cancer can help. Today, we're going to talk about some resources to avoid financial toxicity. And we're going to also spend some time talking about Triage Cancer's free events and resources and information on how to help navigate your patients through cancer-related legal and practical issues throughout the continuum of care. So for those of you who aren't aware, Triage Cancer is a national nonprofit organization that provides education on the legal and practical issues that may impact individuals diagnosed with cancer and their caregivers. And we provide this education in a few different ways. We participate in events all over the country. Some of these events are hosted by our partners in the cancer community, and some are events that we host ourselves. To see where we are going to be, you can take a look at our events calendar. Every year, we host 3 Triage Cancer conferences, and this is a day-long event that covers a variety of cancer survivorship topics. We welcome individuals diagnosed with cancer, caregivers, advocates, and healthcare professionals at this free event. For the rest of the year, we will be in Atlanta and Chicago. For now, those are still in-person events, but if anything changes, we will keep you updated. So if you're interested in those events, registration is open. And we provide free continuing education for nurses and social workers. We also host a monthly webinar series open to anyone in the cancer community. And these webinars provide an in-depth look into different legal, practical, and psychosocial topics related to a cancer diagnosis. And if you happen to miss one of our live webinars, we have recordings of all of our past webinars for view on our website. So we hope to see you at our next webinar on May 14th. We're going to be talking about the latest COVID-19 news, work, insurance, and finances. We also host 2 educational programs that are specific to healthcare providers. The first is our Insurance and Finance Intensive, and this is a comprehensive certificate program for oncology healthcare professionals and advocates on health and disability insurance and finances. And due to the increased demand for online education programs for healthcare professionals during this time, we did have a virtual insurance and finance intensive in April, and we will most likely offer another virtual program as well later in the year. We also have a full-day training on employment called Navigating Cancer, Work and Insurance that we deliver with Cancer and Careers. And we will be offering a virtual in-service program on June 26th. Space is limited for that, so people who are interested in attending should submit an application and will be notified of their acceptance on June 8th. And you can get more information and register for any one of these programs on our website under the Events tab. We have also developed the Triage Cancer Advocate Training to train people who are interested in getting more involved in advocacy efforts on behalf of the cancer community. Advocates accepted into this training program will gain advocacy skills, learn about key cancer-related legal issues that impact the cancer community, and will receive resources to take back into their own communities. We originally had the advocate training scheduled for March 20th to be in Oakland, California, but we have postponed that to happen in October 9th in Chicago. And we will most likely reopen applications for that advocacy training later in the year. So if you know anyone who would be interested, you can stay up to date on this information by signing up for our e-newsletter. In addition to our events, we offer a number of educational materials and resources online. Our quick guides are designed to be a snapshot of a particular topic, and they cover a variety of topics, and we are frequently adding new ones. We have checklists and we have checklists and our other documents designed to help with the legal and practical pieces of cancer survivorship. And not only do we have a lot of education and resources for you or for healthcare professionals, but you can also point patients to these resources or the people that you care for. And all these documents can be downloaded for free on our website, or you may order hard copies of these materials on our website at triagecancer.org/material request. We also have our resources organized by topic. So if you have questions about employment or about estate planning, you can go to one of these resources by topics and see all of our quick guides, our checklists, our past webinars, and then other resources that we link to help answer your questions around those topics. We realize that it can be challenging to find what you're looking for on the internet, so we compiled the contact information for some of the most frequently used state-specific agencies and resources on our site. And because where you live can impact what protections you have access to, we have charts of state laws on employment, disability, health insurance, immigration, estate planning, and more. And I'll say we have done a lot of updating on our chart of state laws and our state resources recently. So those are definitely worth checking out. There's a lot of valuable information. And because we recognize everyone learns in different ways, we also provide educational animated videos on cancer survivorship topics. We have videos on clinical trials, cancer survivorship care plans, health insurance, and employment topics. And these videos are available in English and Spanish, and stay tuned as we have more videos coming soon. We are also very excited to announce that we have several resources available in Spanish, including most of our quick guides and all of our animated videos. Again, these quick guides can be downloaded for free on our website. Cancerfinances.org is a site that we host that provides practical information on topics that can impact your finances. This website is designed to guide users to the information that is most relevant to their situation. We currently have modules on health insurance, disability insurance, education rights, insurance, financial assistance, family building, clinical trials, and caregiving resources, as well as our new COVID-19 and cancer module. And this is where we're putting our most up-to-date information related to COVID-19, so a very good resource to be aware of. And we will have more topics added soon. Triage Cancer and Citizen are partnering to give cancer patients an easy way to organize their complete health history free of charge. Citizen is a free online resource that helps cancer patients quickly and easily request their full medical records from all of their providers. And it's really easy to sign up, and you can sign up at citizen.com/triagecancer. We had a representative from Citizen join us for a webinar in January, and they did a how-to for signing up. So that's available on our resources page if you'd like to see how that process works. And then we believe that it's important for patients to make educated decisions about their treatment choices, and access to clinical trials may be an important option. So we have partnered with Emerging Medicine to have a clinical trials search engine available on our website. And you can find that at triagecancer.org/clinical-trials. And we have our educational blog, which not only provides great information about cancer survivorship topics, but because things are constantly changing in the cancer community, and that statement is so true right now, this is how we share late-breaking news. We also have our monthly e-newsletter, which is where we announce all of our upcoming events. So everything that Triage Cancer offers is completely free, but if you are in a position where you receive a lot of complicated questions, the Cancer Rights Law book is a good reference. Cancer Rights Law provides an overview of key areas of the law that often come into play for individuals who have been diagnosed with cancer and their caregivers, including employment, health insurance, disability insurance, cancer advocacy, life insurance, cancer finances, estate planning, and consumer rights. Joanna Morales, our CEO, and Monica Bryant, our COO, co-authored this book, but we do not sell it. The American Bar Association sells it, but we do have a discount code for 35% off if you are interested. And then I just want to talk about our new COVID-19 resources. We have an upcoming webinar that I mentioned on May 14th. So if you would like to register for that, registration is still open. In April, we had our first COVID-19 webinar where we talked about key changes to insurance, finances, and work. That recording is available on our site at triagecancer.org/webinars. As I mentioned, our blog, we've been posting a lot of blog posts about COVID-19. We have our new checklist about managing work, insurance, and finances during COVID-19. And then lastly, our COVID-19 and cancer module on cancerfinances.org. That is where we are posting all of our COVID-19 resources with the most up-to-date information. So that's definitely a good resource to check out right now. So now let's get into financial toxicity. So in 2013, researchers from Duke coined the term financial toxicity. And in their research, they focus on the financial burden of a cancer diagnosis and how significant that burden can be. Not only in an acute way, but also the long-term impact of that financial burden. And this isn't just about one's bank account. We also have data on how the financial burden is causing stress, depression, and anxiety. And while this is a new term and certainly a popular term, it is not a new problem. But there is no easy solution to the problem of financial toxicity because there are multiple contributing factors. And all or most of these factors need to be addressed to effectively avoid financial toxicity. And we often hear about the high cost of drugs or treatment options as the main issues that contribute to financial hardship that someone can experience. But there are many other things that impact someone's financial well-being. And the primary culprit is having adequate health insurance. Having adequate health insurance can help lower out-of-pocket costs. Also, potential employment changes, whether someone wants to work during treatment or takes off work, whether they are furloughed or they lose their job. And life changes, whether they get married or divorced or they have to move. All of these can impact someone's financial health. And so with employment changes, for example, it's important to understand what options someone has. How can they keep their existing health insurance plan, or if they have unemployment insurance options? And effectively navigating these changes is often rooted in having a good understanding of the law. This is a visualization of the questions that could be asked to patients to help address financial toxicity. And as you can see, it touches several aspects of someone's life, from insurance to work, from practical issues to what their life looks like. And these are the questions that they need to find answers to in order to avoid financial toxicity. So not only does this quick guide list the questions that need to be answered, but also list the resources to help someone find those answers. So if you would like hard copies of this quick guide, you can request this through our materials request, and we can send you hard copies for free. If you have seen this resource from us before, we did just recently update it, so it's worth taking a look at it again to see any changes. So since having adequate health insurance is important to avoiding financial toxicity, it is important to understand health insurance in order to make an educated choice about what type of coverage is right for you. But if you struggle with understanding health insurance, we want to know that you are definitely not alone. For example, only 23% understood terms used in their health policy, and understanding these health insurance terms can help you navigate your health insurance. So there are three main places to get health insurance: directly from a health insurance company, through an employer, which is definitely how most people receive their health insurance, and from the government, primarily through Medicare, Medicaid, and the military. And the most common types of plans are health maintenance organizations, or HMOs, and preferred provider organizations, or PPOs. And both types of plans use a network of physicians, hospitals, and other healthcare professionals to give you the highest quality care. But there are a couple of key differences. With an HMO, you pick one primary care physician. All of your healthcare services go through that doctor. Generally, that means that you need a referral before you can see any other healthcare professional, except in an emergency. And visits to healthcare professionals outside of your network may not be covered by the HMO. For example, if you get a skin rash, you don't go straight to a dermatologist. First, you go to a primary care physician who will examine you. If that physician can't help you, she will give you a referral to a trusted dermatologist in your network. And the benefits of coordinating your healthcare through your primary care physician are less paperwork and lower healthcare costs for everyone. However, in exchange for a lower cost, you typically have less choice and control. With a PPO, you don't need a primary care physician. You can go to any healthcare professional you want without a referral, in or out of your network. Usually, staying inside your network means lower copays and fuller coverage. If you choose to go outside of your network, you'll have a higher out-of-pocket cost, and not all your services may be covered. Typically, PPOs cost more than HMOs. However, you sometimes need fewer appointments and you get more choice. And then lastly, the exclusive provider organization, or an EPO, is a plan that is similar to a PPO, where individuals have a network of doctors and hospitals to choose from. However, unlike some PPOs, an EPO will not pay for any services obtained outside of the network. In other words, there are no out-of-network benefits. And there isn't one answer for everyone in terms of which plan is better. When it comes to choosing a plan, you should consider your personal needs and the options available to you in your area. So now some health insurance terms that we have to understand. So in-network versus out-of-network. Most health insurance policies have a network of providers that have contracted to provide services for a set rate, and that is your in-network. If you go to providers within that network, you will be charged for that contracted rate. However, if you go to a provider out of that network, your insurance policy will not cover the services at as high of a rate, or will not cover those services at all. The allowed amount, or the contracted amount, is the amount an insurance company will pay to reimburse a healthcare service or procedure. The patient will typically pay the balance if there is any remainder. And then some plans will require that you get a pre-authorization for them to provide coverage, which means that before you get that fertility preservation treatment, for example, you have to go to your insurance company and ask if they will cover it. And creditable coverage is insurance coverage you had in the past that you get a credit for when applying for new health insurance. Why would you need credit for prior insurance coverage, you ask? In some cases, your new insurer can penalize you for not having had similar coverage in the past. However, if you had similar creditable coverage in the recent past, you'll get a credit for that coverage and you won't be penalized. There are a few other terms that are used in health insurance coverage that you should understand. And there are costs just to have health insurance coverage, and that is called your premium. And it's what you pay each month to have coverage. You pay these costs even if you never go to the doctor or get any medical care. It's like paying for car insurance all year but never getting in an accident. And there are costs that you have to pay when you get medical care. These are going to be different depending on your policy. First, you have your annual deductible, and this is the amount you have to pay out of pocket each year before your health insurance policy kicks in. And this fixed dollar amount could be $500 or $5,000. Some plans have a $0 deductible. It really just depends on the plan. And next, there is the copayment, and that is also a fixed dollar amount that you pay when you get certain types of medical care. For example, when you visit the doctor's office, you might have a $20 copayment. If you go to the emergency room, you might have a $250 copayment. You usually pay your copayment at the time you get care. And then all plans will also have a co-insurance or cost share. And these two terms mean the same thing. It's the difference in what the insurance company pays for your medical expenses and what you pay for your medical expenses. So you are sharing the cost. For example, if you have an 80-20 plan, the insurance company pays 80% of your medical expenses and you are responsible for 20% of your medical expenses once you have met your deductible. Finally, there is the out-of-pocket maximum. And this may be the most important thing to know about your health insurance coverage. Again, this fixed dollar amount will depend on your policy, and you reach your out-of-pocket maximum by paying your deductible plus any co-payments that you make during the year, plus any co-insurance payments you make. So it's everything that you pay except for your monthly premiums. And once you have met your out-of-pocket maximum, your insurance pays 100% of your medical expenses, and you don't have to pay anything for the rest of the year except your premiums. By understanding how out-of-pocket maximums work, you can plan around what your costs might be in a worst-case scenario, and hopefully avoid financial ruin after a serious medical situation. When thinking about your out-of-pocket maximum, remember that insurance companies usually only count expenses that are from an in-network provider. And so to give you an example on how an out-of-pocket maximum works, meet Dan. Dan was in a car accident and had to go to the emergency room and then spend a week in a hospital that was in his policy's network. Dan ends up with a $102,000 hospital bill. How much of that does he actually have to pay? So I actually have to do some math. So his health insurance plan has a deductible of $2,000 and his co-insurance is 80-20. His plan's out-of-pocket maximum is $8,000. So he has to pay his $2,000 deductible before any of his other coverage that's in, leaving him with a $100,000 balance. Since he has met his deductible, the insurance company will pay 80% of the bill, and he's responsible for 20% or $20,000. But his plan has that out-of-pocket maximum of $8,000. So how much of that $20,000 does he actually have to pay? Remember that he's already paid $2,000, math, so many numbers, $2,000 in deductibles, which means that he only has to pay another $6,000 out of pocket, and the insurance company will pay the remaining balance. So while I'm certainly not saying that $8,000 is not a lot of money, it's certainly less money than $20,000, which is why that out-of-pocket maximum is really important for helping reduce out-of-pocket costs. And while you may know these health insurance terms or you know how to help figure out what you have to pay, maybe patients or people you care for are confused about these terms. So we have an animated video on health insurance basics and picking a health insurance plan that can be used to help explain these. So finding the right health insurance plan can feel overwhelming, and it can be especially hard to know how to choose between 2 or more health insurance plans. So whether you plan to buy a plan in the state health insurance markets, if you're choosing between 2 or more plans offered by an employer, if you want to compare an employer plan with a marketplace plan, or you want to compare your Medicare options. So when comparing plans, it can be tempting to just choose the one with the lowest monthly premium. So for this example, Bronze plan has a $173 monthly premium. But to figure out how much the plan may actually cost you by the end of the year, you have to do some math. And you can use this math equation to help compare the cost of different plans. So first, you take the monthly premium and multiply it by 12, which is how much the premiums will cost you for the whole year. Then you add the annual premium to the out-of-pocket maximum. Generally, this is the most you will have to pay out of pocket for your medical care during the year. If you have a serious medical condition and see a doctor more often, then you are more likely to reach your out-of-pocket maximum. So at first glance, it may seem like the Bronze plan is less expensive than the Silver or Platinum plans, but after doing the math, the Platinum plan is actually more affordable. It's almost $2,000 less. But there are some other things to consider when looking at the cost of the plan. Some plans may have a high deductible, which means that you have to pay a lot of money up front before your plan starts to pay their share of the costs. For example, some plans have deductibles as high as $7,350, which is a lot of money to bring up front. Other plans may have a more expensive monthly premium, but have a low deductible and lower out-of-pocket maximum, which spreads the amount you have to pay out of pocket throughout the year. So after you look at the cost of the plan, then you need to see if your doctors and other healthcare providers are in your network. Many plans will not cover medical care that you receive from an out-of-network provider. And even if they do cover some of the medical plans, you will have to pay more out of pocket. So make sure that your doctors, your hospitals are in network. The final step is to make sure that the plan covers any prescription drugs that you are taking. Otherwise, you may end up paying more out of pocket to access your medications. So just briefly on employment rights, there are a lot of laws around employment that may be useful to someone who either wants to work during treatment or take time off. And we provide education on all of these topics related to the cancer community. So if you have questions about these or want more information on employment, you can visit our employment resources page. We have many quick guides, checklists, and webinars, both webinar recordings and upcoming webinars around these topics. So now turning to disability insurance. When someone is diagnosed with cancer, there is often at least some time that they will need to stop working. And if that time is extensive, most people will need to find a way to make up for the fact that they aren't bringing home a paycheck. And that is where disability insurance comes into play. It replaces your income that you lose because you are not working due to your medical condition. And insurance policies will normally only pay you a portion of what you normally got paid. Policies range from 45 to 90% of your monthly income. And there are several places where you can get disability insurance. And the first is a private policy. There are short-term and long-term policies. A short-term policy is generally going to be one that covers a disability that lasts up to 6 months or a year. And a long-term policy are generally for medical conditions that last a year or longer. And these private policies can be purchased directly from an insurance company or may have access to a policy, or you may have access to a policy through your employer. And where you get coverage as an employee benefit, similar to a health insurance. So your employer may pay all or part of your monthly premium, and Aflac is one example of a company that offers short-term disability insurance coverage through your employer. But if your employer doesn't offer a policy, you can still get a private insurance company. You can go to them to buy a policy. One example is Mass Mutual. However, when you buy a private policy, they can deny you or charge you a premium based on your pre-existing condition. The protections for people with pre-existing conditions that exist in the health insurance market don't apply to disability insurance. So if you have already been diagnosed with a serious medical condition, then it may be difficult for you to get access to coverage. And the details of these private policies are going to differ from plan to plan and state to state. In addition to private policies, there are a handful of states that have state disability insurance policies, but like private policies, the details differ from state to state. So if you live in California, New York, New Jersey, Rhode Island, Hawaii, or Puerto Rico, then you may have access to a state disability insurance program, but these are generally short-term benefits that last up to a year. Usually the standard of disability is lower, less work to do to prove that you are unable to work because of your medical condition than if you are applying for the federal programs. So if you want more details about your state's benefits or to find the contact information to your state's program, visit our website at triagecancer.org/state resources. And then finally, there are 2 federal disability insurance programs. Both are administered by the Social Security Administration, or SSA. And these are Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI. And both are long-term programs that have a very high standard of disability. You can visit ssa.gov for more information on SSI and SSDI. And that was just a very brief overview of disability insurance. There is a lot of information that can be said about disability insurance. So for more information, you can check out our quick guide to disability insurance, or you can register for our upcoming disability insurance webinar on May 20th. So a lot of the content that I talked about today and that Triage Cancer provides ties back to the financial impact of a cancer diagnosis. So you may encounter a patient in a situation like Abby. So meet Abby. Abby was 42 and had worked at an architecture firm for 2 years before being diagnosed with cancer. Based on a conversation with her doctor, she decided to take some extended time off to deal with her treatment and recovery. She told her supervisor, who is also a personal friend, what was going on, and her supervisor was very supportive. He even set up an online fundraiser to help Abby with her medical bills. 1 month into her leave, Abby was let go. Abby elected COBRA to keep her health insurance. With her savings, she was able to scrape together the monthly premiums. Now her savings are depleted and her 18 months of COBRA are up, and she is trying to figure out her health insurance options. She is completely overwhelmed by all the information on the internet and in the news and doesn't know how to choose a plan other than picking the one with the cheapest monthly premium. Abby has been receiving disability insurance and she is considering trying to go back to work, but she is still suffering from some side effects and has a follow-up medical appointments that may have to occur during work hours. Abby has a large amount of debt as she has used credit cards to pay some bills. She is ready to get on with her life and wants to buy a home, but feels weighted down by her financial situation. She also doesn't know where her medical care goes from here now that her oncologist has released her. Her friend also recommended that she get a power of attorney for the future, but she has no idea what that means. Abby feels like she wants to give back, and that given her experiences after her diagnosis, she wants to fix many of these systems. So with an example like Abby, you can see how many things can come up in just one person's situation. So for Abby to navigate these systems and for a healthcare professional to help Abby, she needs to know about FMLA, about disclosure, about the ADA, about how to navigate the insurance marketplaces, and how to elect COBRA. She needs help finding a job and reasonable accommodations. She needs help with her finances. She needs a survivorship care plan. She needs help with estate planning and advocacy. And to help Abby navigate through her situation, it's important to gain information about these topics and to know where to find answers when you don't know. And this is important not only for you to advocate on behalf of your patient, but for your patient to advocate for themselves. So when your patients have questions, or for people that you care for have questions, you can go to our resources to help you answer their questions. But if you still have questions, you can point them to us. And if you have questions about patients or about a difficult case study or a situation that you're working through, you can reach out to us by email, which is going to be the fastest. And you can email us at info@triagecancer.org. And we hope that you become involved with Triage Cancer and stay up to date on our upcoming events and resources. So if there are any questions, I would be happy to answer. Thank you.
Abby, there was one question in the chat box. Are you okay with sharing the slides from today?
I will not share them, but I can create a resource page that has all the links to the resources that I mentioned, so that contact information is clickable and easy for people to get.
Okay, thank you. Feel free to come off mute and ask your questions to Madison. I did have a couple questions. I can start with the trainings you presented at the beginning of your presentation. Is there any cost associated with any of those?
For the attendees?
Yes.
So they need to travel or have a hotel room for that. That would be a cost, but in terms of like, we provide breakfast and lunch. We provide free CEs for those, and then all the materials are free. Signing up is free. So just, I guess, any travel costs an attendee could incur.
Thank you. And I know you've done some statewide presentations in the past. Could you tell us a little bit about what you maybe would be able to offer to Colorado if we were to try to have you come here to do a presentation?
Yeah, so we could do, if you wanted to have healthcare professionals or advocates trained, we could do an insurance and finance intensive. And all of our programs that we do for healthcare professionals or our conferences, we tailor the information to what states are in the room. So if we're in Colorado, I'm guessing some Colorado people are going to be in the room. So then we'll kind of tailor our examples and our numbers and what state resources are available to that audience. So that's kind of how we handle doing those, going from state to state.
Great, thank you. Any questions from the group?
Madison, this is Tammy. Can you hear me?
Yes. Hi, Tammy.
So I'm an oncology navigator, and I just really appreciate the information that you've shared today. And thank you for being willing to put together that document with the links to the different resources that you've presented. I really appreciate it.
Yeah, you're welcome. I can get that done today, and I'll send it to Jen to distribute.
Great, thank you.
Yeah.
This was awesome.
Thank you.
Is there any other questions? We will have a recording of this presentation on the Cancer Coalition website. So if you want to go back or share it with your colleagues, definitely take a look for that. But I'll give one more minute to ask any last minute questions.